Our next presentation is extremely important. We'll be talking about the role of the caregiver. It plays a huge part in any disease, but especially in cancer patients. Here today to discuss this is Dreama Taylor. She's a registered nurse. And Ashley Kowashek. She is a social worker. So Dreama Taylor is a registered nurse, is a patient navigator at Tallahassee Memorial Cancer Center. She is an oncology certified registered nurse and worked in the oncology area for 20 years. She provides education, support, and paves the way for oncology patients. And then also Ms. Ashley Kowashek. She has been part of the Tallahassee Memorial Cancer Center team since January 2014. As a part of the navigation team, Ashley assists patients and families with getting connected to resources and services. She also provides educational material, coordinates patients' appointments, and provides counseling services. Please welcome Dreama and Ashley.
Well, I'm a nurse, and to follow 3 physicians, I don't know, it's a lot of pressure, but here I go. I do work at Tallahassee Memorial Cancer Center, and we are accredited by 2 organizations, Commission on Cancer and the NAPBC, which is National Accreditation Program for Breast Cancer Center. And to maintain our accreditation, we have to meet standards, and several of the standards are related to the patient navigation system and process. You know, patient navigators are emerging in all areas of healthcare now. At Tallahassee Memorial, we have 5 on our team. So we all work together and see patients, and we're constantly assessing our program. We last month had, the 5 of us had over 500 encounters. Of course, it's based on individual patient assessment, but we educate patients and family about their disease and their treatment plan. And we do that in the beginning when a patient is diagnosed. But then a lot of our physicians, when patients reoccur, will call the patient navigator in. So we're a part of that. And we continue to follow these patients. You know, it's not like we educate them and then leave them. We follow them through their survivorship. So we offer chemotherapy education, and we recently have started to offer regimen change education. So as the physicians were talking, you know, when patient goes from one regimen to another, then we're there to educate the patient. We also provide emotional support, and we do that with free counseling from our mental health care provider, Ashley, and you'll get to meet her soon. We also coordinate services among medical providers. So what we do a lot of times is meet with the patient, and they usually will see a medical oncologist, a radiation oncologist, sometimes the surgeon. So we'll help them to coordinate, and you know, we're helping the patient, but at the same time, I feel like we're helping the whole family. And we find financial resources for patients. So as patients move through their cancer care, you can only imagine the impact, financial impact. So we help them with that. We arrange transportation for patients. Some patients will need us more than others, but we connect them to the American Cancer Society, and they have an excellent program, Road to Recovery, where patients are actually picked up and carried to treatment, and usually by survivors that have volunteered their time. We also link patients to healthcare resources. So as patients move on through their treatment, And some patients may need walkers, wheelchairs, beds. We connect them and we will follow with the family just to make sure that they have the resources they need. We also communicate with the physicians and other members of the healthcare team. We go to the tumor conferences and listen to physicians discussing patients. Sometimes that's when we pick up recurrent patients and we're able to make contact with them. And like Dr. Marina said, we do have weekly physicians rounds, and patient navigators are there to listen and address any barriers that patient may have, and just to educate the patient along the way. We provide support. We've got 2 full-time dietitians. We do arrange and talk to patients about palliative care following the recommendation of the physician, hospice, home health care services. We do have patient navigator, Sandy, who is certified in that area and helps us. We all just work together. And we really do bring the focus back to the patient and the family. And, you know, we work with them at diagnosis and follow them through their treatment. And if it's recurrent disease, we do that. And I have developed long-term relationships with metastatic breast cancer patients. I've been there a long time. So, thank you. And Ashley's going to talk about caring for the caregiver.
Thank you for having me. So, as you all know, cancer not only affects the individual who's been diagnosed, it affects all the caregivers, whether that's a spouse, a partner, a child, a sibling, a friend, a neighbor. It could be absolutely anyone. Anyone falls under the caregiver realm. But the person who is the caregiver participates in the care of the patient. They provide the support to the physical and emotional well-being of that individual. So the roles of a caregiver go anywhere from home health aide to a companion, going to get some coffee. Some of these tasks include helping to feed the patient or individual, dressing them, bathing them, arranging schedules with all the different appointments with the medical providers, managing insurance issues, providing that transportation every day to radiation, serving as a legal assistant or the financial manager, trying to figure out where can things go so we can make it by this month, or taking over the duties of that patient while meeting the needs of the family members, other family members. So caring for a caregiver can come in many different realms. As much as you're taking care of that individual going through the treatment, you need to take care of yourself. That is the #1 priority. You've got to monitor your own health. Because if you can't monitor your own health, you can't take care of the individual who needs you to. Physical, emotional, mental, all under that umbrella. Monitor your own stress levels. Set some boundaries. It's okay to do that. Ask for help so you can take a break. Saying no if you don't want to do something or don't have that energy right then. Good news is about a support system is that there's many different people who are willing to tag team it for you. Decide together, you and the patient, what you can do to support each other. You guys are in this together. Plan for activities that you enjoy. Going to the movies, drawing, running, anything. If it can be a 10-minute task of the day, breathing exercises, anything just for yourself. Consider talking with a mental health professional if you feel like that could be beneficial to you. Like Dreama said, at our cancer center, we do have social workers who are available to talk to the patient, family members, children, anyone. They're easily available to you. Just ask. Find support, whether that's in a family member, a friend, support group, etc. Asking for help is not a sign of weakness, it's a sign of strength. As a healthcare provider, you need to understand all of us need to understand that cancer is far-reaching and it not only impacts the individual, but also the caregivers. And you are just as important as our patient. We need to constantly be checking in with you and making sure that you're getting all the emotional and information that you need, support-wise. I don't know if you guys have gone through your little book today, but they included a really great little survey for yourself of for caregiver burnout. It's a great little survey, just a quick little questionnaire, and then it's a point system that explains to you kind of where your level is and little tips and tricks. I didn't know that was going to be included, so that helps me out a lot, because then you guys can take that home and just monitor it for yourself. Thank you.